What to expect from a brain tumor biopsy? If you are facing a brain tumor biopsy, you might be wondering what the procedure entails and what to expect. A brain tumor biopsy is a medical procedure designed to obtain a small tissue sample from a brain lesion or tumor. This sample helps doctors determine the nature of the tumor, guiding diagnosis and treatment options. Typically, a minimally invasive technique called a stereotactic brain biopsy is used. However, in some cases, an open biopsy, also known as a mini craniotomy, may be necessary. Before the procedure begins, your head will be carefully positioned and secured, often using a fixation device or a head frame. This ensures that the surgeon can accurately target the tumor. Imaging scans, such as magnetic resonance imaging or computed tomography, are performed before and sometimes during the procedure. These scans act like a GPS, guiding the surgeon to the precise area of interest. Once you are prepared, a small area of hair near the biopsy site may be shaved, and a small incision is made in the scalp. The surgeon creates a tiny hole in the skull, called a burr hole, which is typically about the size of a dime or quarter. Through this hole, a thin biopsy needle is carefully inserted into the brain tissue. Computer-assisted navigation is used to avoid critical brain areas while collecting one or more small tissue samples from the tumor or lesion. After the samples are taken, the needle is removed, and the incision is closed with sutures or staples. During the procedure, if the tumor is located near vital brain regions that control functions like speech, movement, or vision, you may be awake but under sedation and local anesthesia. This allows the surgical team to monitor your neurological function throughout the process. After the biopsy, the samples are examined immediately by a pathologist for a preliminary assessment. They will undergo detailed analysis with special staining, which can take several days to finalize. You will usually stay in the hospital for a short period, often just overnight, although some biopsies may be performed as outpatient procedures. The incision site will be monitored for signs of infection or bleeding, and sutures are typically removed within 10 to 14 days. It is common to experience mild discomfort or a headache after the procedure, which can be managed with medications. As with any brain procedure, there are risks involved. These can include bleeding, infection, swelling, and potential neurological deficits, depending on the tumor's location and the biopsy approach. However, a biopsy is essential for differentiating tumor types, infections, inflammatory conditions, or other brain diseases. This information enables personalized treatment planning. In some cases, if a larger tissue sample is needed, or if there is a higher risk of bleeding, an open biopsy via a mini craniotomy may be performed instead of a needle biopsy. Overall, a brain tumor biopsy is a critical diagnostic step in managing brain cancer and brain health. It is performed with careful planning and advanced imaging guidance to maximize safety and diagnostic accuracy while minimizing disruption to normal brain tissue. It is important to discuss individual risks and benefits with your neurosurgeon and care team to fully understand the procedure and receive personalized care recommendations.